Hello friends and family. I've been working on this video now for a little bit over 24 hours, and I have to say that this is actually the third time that I've recorded it, because every time I'm about to put it out, essentially we get such new and different information that it's almost not worth putting it out at all. However, I have made a shorter video that I think I'm going to keep to about 4 minutes, that I think I'm going to try to recap as much as I can. So I'm going to get into it. It's going to be a lot of information. Feel free to watch it again. Very important stuff. Start off real quick. So this virus, it's being called the nCoV-19 novel coronavirus. It is in the same family as SARS, as MERS, which we've had previous scares with in China and around the world. It is similar, however not completely identical, to a virus that is found in bats and koalas and cats, I believe. It was first reported as being an issue to the World Health Organization on December 31st of last year. So essentially starting on New Year's was when this whole process kicked off. Traditional symptoms that you will get from coronavirus, as I'm sure you've already heard, it's a lower respiratory distress, fever. Obviously some people report congestion, headaches. More rare cases, you're seeing nausea, diarrhea. But especially flu type symptoms and fever are the two biggest contributors, along with any type of epidemiological factor, as in if you've been in contact with somebody that's recently traveled to China, or if you yourself have recently traveled to China. And any of those things together makes you a person that could be under consideration for either being under what is called close contact watch, or a PUI, which is if you're showing symptoms and match one of these criteria, then you're a person under investigation. Speaking of PUIs, our official numbers right now, as I'm recording this video, and I'm going to refresh the page right here that I have it in front of me just to make sure that I don't, give you a bad number. We have 132 deaths, 5,578 confirmed cases, and not confirmed, but that number is actually much closer to 6,000 from what I've heard already on Weibo and a couple different Chinese sites. So the Chinese government is going to start updating us now twice a day instead of just once a day on what these numbers are looking like, because they're starting to change more and more rapidly. The numbers of people that are in critical condition right now is actually really high. I'm going to pull it up, but we have so the new number is 6,058 confirmed cases and 1,109 in critical condition. So you can see how from 132 fatalities, we can easily jump up if, unfortunately, any of these people that are in serious condition end up not making it. Right now, the White House and President Trump is debating on whether or not to cancel all flights to and from China to the United States. That announcement has not been made. However, United Airlines made an announcement that it's going to be refunding people, and other airlines are starting to follow suit as well. Right now, one of the big things that everybody is talking about is whether or not this virus is contagious before you show symptoms. And while the CDC was very directly asked this question this morning, and they said that we cannot independently confirm with our data that there is risk for asymptomatic infection. However, China, once again, has come out, and the Minister of Health has said that he has seen cases of asymptomatic transfer. And with an incubation period, which the CDC, again, has said is anywhere from 2 to 14 days, you're looking at a situation where we don't have enough information yet on the onset of symptoms and on the shedding of this virus to be able to really know at what point during the incubation period you can start to infect others. And so because of that, we are so much in the early stages of this that we really are just making assumptions. Everybody, included. One of the main takeaways that I got from the press conference this morning was that there's a lot that we still don't know. And they said that many, many times. I'm going to move on here. So we know that the epicenter of this was in the city of Wuhan in the Hubei province. But now we have more than 30 provinces in China that have been reporting the different confirmed cases of coronavirus. Right now, all the cases in the US have come from people that have either been to China directly, specifically Wuhan or Hubei province, and or have been within close contact, which is considered within 6 feet for more than 10 minutes with a person that had been recently in that area or traveled there. So right now, all testing is having to be done in CDC labs, and the CDC is actively working to decentralize the system with the reverse polymerase, what was it called? Reverse transcription test that they're doing. They're trying to make it available so that medical facilities, hospitals can do more of this testing independently of the CDC. But that is going to still take up to a week, if not more. That means that we are still at a backlog of testing where these labs are seeing 48, 72, and sometimes more hours of wait time before they can get these cases back and be able to either confirm or deny whether somebody has coronavirus. Here in the US right now, we have 110 people that are under investigation, which means they're showing symptoms, they're consistent epidemiologically with the travel or close contact, and they have been tested and are awaiting results. Of those 110, 9 have been here in my home state of Washington. So obviously that's a little bit concerning for us. And we currently, I believe, are watching, it was 64, 68 people for close contact. Again, meaning they've been within 6 feet and for more than 10 minutes with somebody that has been considered a potential carrier of NCOV-19. Hong Kong has closed most of its borders with China and is now, I think, dropped incoming traffic to less than 2%. And the threat level from the US to China has been raised to a level 4 for the Hubei province and a level 3 now for all of China. All non-essential travel should not be happening to China at this time, again, over fears of infection with coronavirus. All 5 people in the US that have current tested positive for NCOV were showing symptoms after they got here, which again speaks to a long incubation period potentially, and also which, according to the CDC, if there's no asymptomatic transfer infection, then if they weren't showing symptoms, then we would hope that on these planes and any type of public transportation or anyone else they came in contact with would not have been capable of being infected. However, the jury is still out on that. We don't know. One of the things that stood out to me was a reporter asked the CDC directly about stores running out on masks and other kind of equipment that would be used in this kind of a situation. And straight up, they said the risk to the population right now in the US is low. Don't worry about masks. Don't worry about wearing masks. And that struck me a little bit just because I didn't really want to hear that messaging coming from the CDC. And again, this is just my opinion. I have told my friends and family to buy masks. What's the worst thing that could happen is in 2 weeks, this whole thing blows over and you can return them. No loss. However, if it turns out that things do get worse, by the time that they make an official announcement, go buy your masks, guess what? They're going to be 100% sold out. So it's up to you, really. I am urging everybody, do your own research, look into this, be familiar with the symptoms, be familiar with what the CDC, the WHO, your local health departments and officials are saying about this. Stay tuned, talk with your friends, set up plans, have backup plans. If you have a way to get, like I said, masks, way to purify water, get any kind of preserved foods, dried foods. The CDC is talking as if though this is something that they are getting ready for in the long haul. And I also want to make sure that we are prepared and not panicked, not scared, but looking at the facts, seeing the possibility of potential outcomes, and trying to stay a step ahead as possible. Right now, we are on schedule, and in some statistics, we are ahead of schedule with predictions and modelings that has been done with the numbers of this outbreak based on the official counts that we have. And that's, obviously not to mention all the reports that we have from the fact that a lot of these numbers are being underreported, either because of the way that the statistics are being gathered or the fact that maybe China is just not being forthright with its numbers. And I have asked this also directly to health officials, and nobody's willing to tackle the question. However, the amount of skepticism is growing, and I've even heard it said directly from the CDC in press conferences where they say that they have urged the Chinese to be as transparent with their statistics as possible, whatever that means. So, anyways, just wanted to get a lot of this information out there to you. We're obviously, still on the cutting edge, and so I will hope to keep you guys advised. Follow me on Twitter, Hectorology, and also on Facebook for more information, or on Instagram. I'm also editing a profile at Coronavirus Info on Twitter with a group of other people, and we'll keep posting things as we see them happening, hopefully with as much credible and helpful information as possible. Thanks for watching.